Welcome to our video on auscultation, a vital clinical technique used to listen to the heart's valves using a stethoscope. Proper auscultation can help diagnose various heart conditions by detecting abnormal heart sounds. Let's go through the specific locations for listening to the different heart valves and Erb's point. To perform auscultation, follow these steps. Mitral valve. Place the stethoscope at the fifth left intercostal space, 1 centimeters medial to the mid-clavicular line. This is the best location to hear the sounds of the mitral valve. Pulmonary valve. Position the stethoscope at the second left intercostal space, close to the midline. Here you can listen to the pulmonary valve. Aortic valve. Place the stethoscope at the second right intercostal space, close to the midline. This is where you can hear the aortic valve. Tricuspid valve. Position the stethoscope at the fourth intercostal space at the lower right sternal border. This location allows you to listen to the tricuspid valve. Erb's point. Place the stethoscope at the third intercostal space, left lower sternal border. Erb's point is a significant auscultation site because it allows you to hear both the aortic and pulmonary valve sounds and detect any potential abnormalities. By carefully listening to these areas, clinicians can detect murmurs, clicks, and other heart sounds that may indicate underlying heart conditions. Proper auscultation technique is crucial for accurate diagnosis and management of cardiovascular diseases. Thank you for watching this video on auscultation. Stay tuned for more educational content on clinical examination techniques and medical diagnostics.